Hello and welcome to our second episode of the Campbell University Drug Information Center's Newscast. I'm your host for today's show, Dr. Scott Perkins. In today's video, we'll be covering a couple of news stories from the past quarter, including updates to the ADA standards of medical care in diabetes, some new information about birth control in North Carolina, first-in-class medication for the treatment of heterozygous familial hypercholesterolemia. But before we begin, I wanted to thank the writers for today's show, Dr. Adrian Bundrick, and P4 students Amber Hill, Brianna Blue, Amanda Choi, and Anthony Sigia. Of course, stay tuned to the end of the episode to get some new information about new drug approvals and new indications for medication. Let's get on with the show. In January, the American Diabetes Association published the 2022 Standards of Medical Care in Diabetes. There were several notable pharmacologic updates that we'd like to highlight in today's video. First, the ADA guidelines now recommend a greater focus on specific factors when selecting therapies. Specific factors include ASCVD risk, heart failure, chronic kidney disease, obesity, risk for specific adverse effects from drugs, safety and tolerability, as well as cost. The update recommends an incorporation versus a sequential add-on approach with both initial and subsequent glycemic management, independent of A1C. For example, although metformin is still recommended as a first-line pharmacotherapeutic agent, the updated guidelines recommend considering other agents in addition or as an alternative based on patient-specific factors. The same applies for add-on therapies and medication adjustments, again, regardless of the A1C values. This update stems from literature that has been published over the past couple of years, noting benefit with specific agents in patients with certain comorbidities, the main ones being GLP-1 receptor agonists in patients with ASCVD and SGLT2s in heart failure and CKD. Last, the guidelines recommend that GLP-1 receptor agonists, if possible, should be used as the first treatment option in patients who need injectable therapy, as well as adding GLP-1 receptor agonists to patients who are already on insulin therapy, who just simply need better glycemic control. This recommendation was guided by evidence demonstrating improved glycemic control with GLP-1s and insulin combined, compared solely to basal insulin monotherapy. Of note, the updated guidelines recommend insulin therapy in those with evidence of ongoing catabolism seen by weight loss, symptoms of hyperglycemia, A1C above 10%, or blood glucose levels greater than 300 milligrams per deciliter. For a complete list of changes to the standards of medical care in diabetes, see the link in the description of this video. On December 22nd, 2021, the FDA approved inclisiran, or brand name Leqvio, to be used as an add-on therapy for the treatment of heterozygous familial hypercholesterolemia and atherosclerotic cardiovascular disease. Approval of this drug was based on the results of Orion 9, 10, and 11 clinical trials. Inclisiran is an injectable medication which patients will only need to receive twice a year. Patients will receive 284 milligram dose at initiation and 3 months and every 6 months thereafter. This is a potential advantage over other current PCSK9 inhibitors, which are administered much more frequently. In clinical trials, patients who took this medication experienced a greater than or equal to 40% decrease in LDL-C compared to about 1 to 8% increase in LDL-C in patients taking placebo from the beginning of the study to day 510. As of March 2022, there are no specific warnings listed in the package insert for this medication, but injection site reactions were found to be the most common side effect, and occurring in about 8% of patients. Links to the trial data are provided in the description of this video. As an update on the information provided last episode about telepharmacy, AJHP published a pharmacist-led systematic review and meta-analysis on March 2nd. They stated the impact that telepharmacy interventions have had in diabetic populations, including throughout the COVID-19 pandemic. Their final analysis included 36 studies with almost 14,000 patients whose diabetes had been managed using telecommunications to some capacity. In the telepharmacy patients, A1C was lowered by 2.1% compared to 1.3% in the control group. Telepharmacy patients also had a 2 times greater chance of having an A1C that was less than 7%. There was also a significant reduction in hypoglycemic events in the telepharmacy group compared to the control arm. The study implies that telepharmacy services may be as beneficial as face-to-face interventions regarding diabetes management. While numerous randomized controlled trials were including a trial with about 5,000 patients, most of the studies included were observational. For those who are interested in reading more, we've included the link to the study in the video's description. For this next segment, I am excited to introduce Dr. Katie Trotta. She is an associate professor here at Campbell University College of Pharmacy and Health Sciences. She works in our community care clinic on campus. I mean, I don't want to.
Don't list them all.
Yeah, I'm not going to list it all. But goodness, you do so much around here. And I've invited you on to kind of talk about sort of a birth control situation that we've kind of got going on here in North Carolina and excitement around that.
Love it.
Have at it. Yeah.
Okay. So we have a lot of expanded practices available now in North Carolina as pharmacists, all under House Bill 96. So today, I guess we'll hone in on the hormonal birth control section of that bill. In the broadest sense, it allows pharmacists to be able to prescribe and dispense hormonal birth control under a statewide standing order protocol from our state health director, who at this time is Betsy Tilson. So if a woman or person comes into the pharmacy and requests hormonal birth control, we will go through a treatment algorithm developed by NCAP, which we can talk about that in a moment as well, and select the best option for her and prescribe that birth control, write the prescription, put Betsy Tilson's name on it, which may sound familiar if you're watching this because that's the name that you put on any naloxone prescriptions that you write, and then dispense the medication, just like we would dispense any other medication. So it's very cool. It is definitely a way that we are advancing our profession, and I'm excited about it.
Yeah, this has kind of been a long time coming. California did this, in 2016,
I think?
Something like that?
Yep.
So, and I remember hearing kind of bubbling this might happen at some point, and the fact that it's finally here is pretty great.
Yep.
So.
But we are one of the only states that has something like this, I think, enacted. A lot of states have things in the works, but not that many actually have them where the law is in practice. So
yeah. Cool. Well, how do you think this is going to change kind of practice here in North Carolina? Is this going to be something that's going to cause any kind of workload issues, or
I think the biggest thing will be if we can get reimbursement for the service. And so I know NCAP is working now. They put together a committee for payment and reimbursement. And they're starting with Medicaid because that's the easiest low-hanging fruit for us to get reimbursement through. I think if we can get reimbursement, more places will be on board. But as of right now, we only get reimbursement for the product that we dispense and not the service. And it is a pretty lengthy counseling process that we have to go through when someone comes in and requests this. So I don't really think, I don't foresee the chains really jumping on board because it's going to take so much time, which is great for us because we get to spend that time with our patients. But in the business sense, it's not the best model for reimbursement right now.
Well, so tell me about that algorithm you had mentioned. Is it complicated? I haven't seen it. Is it something that's...
Well, let me back up a little and talk about the training.
Sure. Yeah. Yes.
So in the, as part of the bill that passed, all the pharmacists that are going to be dispensing this birth control have to complete a hormonal birth control training. And all the bill mandates that the training has to be the NCAP provided training. So there was a work group that got put together with some people that are big in women's health in the state. Our own previous Brock Woodis was one of the members of the committee, and he helped to put that together. And it's really well done. I've looked through all of the materials. There's 5 modules that you have to complete. And then there are some kind of, not necessarily toolkits, but templates and things to help you when you are prescribing. So algorithm. It basically walks you through a bunch of different screening questions that you need to go over with the woman before you can prescribe the birth control. So it's making sure that she's low risk for blood clots or some of the other high risk things that are associated with hormonal birth control. So we can only dispense if the person does fall into the low risk category. If they're higher risk, then we need to refer them back to their PCP. And so we have to make sure that their blood pressure is less than 140/90. They don't have a history of blood clots. They're not over 35 or obese. Those things kind of increase risk for blood clots. And so those would be cases that we can't dispense the medication. So I think it's really comprehensive. And I was actually talking to Penny when we were at APHA, and I thought this was really interesting. She was on a working group with the physicians that were looking at the standing order before it got signed. And they were all kind of going around and giving their opinion. And the last person to give their opinion was like, you know what I think about this? And Penny was like, what? And she said, I think it's great. I actually used this algorithm yesterday in my clinic when I was prescribing a birth control for a patient or starting a patient on a new birth control. And I was like, that's awesome. Like our algorithm and our training is like so comprehensive that even our physicians are able to use it in their clinic. So although it does take a little bit more time, I think it's the quality of care that our patients deserve to receive. And it's not just, here's your prescription for Yasmin, be on your merry way. It's, here's your prescription for Yasmin, here's all the things that can happen that are beneficial and maybe some of the adverse effects associated if you choose to take this. So
yeah, that's exciting.
Very exciting. And I forgot to say, the North Carolina Board of Pharmacy is going to pay for the training through NCAP for the first 6,000 pharmacists that complete the training over the next 12 months. So if you are interested in completing the training, you can do it right now for free. So just go through the Board of Pharmacy. It links directly to the training, or if you want to go on the NCAP website, that also gives you the link. And if you're a student watching this, there are conversations now about how we'll get our students trained before they get out into practice, if you're going to be graduating after the next 12 months. So we're working on that too.
So outside of that, if let's say someone waits and delays, how much would it cost? If the board,
I'm not sure right now because the board and the NCAP kind of negotiated some payment. So I'm not sure how much it would be for like the general public. I think the LAI training is $249. So I would assume it would be somewhere around that price.
Okay. So yeah, get your training now while you can for free. So,
yep.
Fantastic. Well, thank you so much for coming on.
Thanks.
I really appreciate it. So
thanks for having me.
We'll have you back on soon.
Hopefully I gave a good overview of the bill.
Oh, you did. It was fantastic.
Thank you.
Fantastic. Thank you. That's it for this episode of our newscast. We'll leave you with some information about new drug indications and new approvals. We hope you found the video informative. Thanks for watching, and we'll see you in another episode.